All right, so I'm gonna review the physician's orders here. Okay, it says to give an injection, IV push, so I'm gonna gather my supplies. Here we go. All right, so now I'm gonna drop my medications. The order said 2 milligrams, and the dose that I have here on this vial is 2 milligrams per milliliter, so I'll be drawing up 1 milliliter. So I'll get started with that. Okay, and before I poke the cap of this one, since it's been used already, I'm gonna wipe it. Okay, wiped it down. Gotta drop 1 mil. Okay. Okay. Then inject it very carefully. Okay. There we go. All right, and then we're gonna dilute it with 5 milliliters of normal saline. Okay, so very carefully. Gonna drop 1 mil. Good. Okay, now I'm gonna activate my safety mechanism here. All right, cap this one again. Now that I've drawn up my medication, I'm going to label it. So I'm going to put it below the numbers here so I don't cover it, make sure it's good. I'll write the name of my medication and the dosage. Alright, so my patient has a C. diff infection, so I'm going to need to use contact precautions. So I'm going to gather my equipment, get my gown here and my gloves. There we go. On, being careful not to touch the inside of it. Alright, don't let the gown touch the floor. Alright. Okay. Alright, I'll put the gloves on. Make sure I put them over the cuff. Same with the next one. Hello, my name is Pedro. I'll be your student nurse today. So we're going to be given a medication today. Could you please say me your first and last name and date of birth? Okay. Just verifying here. Perfect. All right. And are you allergic to anything? All right. Thank you. Today we're going to be giving you hydromorphone through your IV site. You said you had a pain of 8 out of 10, and you have hydromorphone as needed, 2 milligrams. So we're going to be giving you that, and hopefully your pain will go down. And after we give it, we'll assess it at the peak time, which is 30 minutes. Is that okay? All right, perfect. All right, so I'm going to check the IV site, make sure it hasn't infiltrated or anything like that. Looking for any signs of redness, swelling. Do you have any pain on the site? Okay, you don't. All right, so it looks good. So I'm gonna unclamp the IVs and flush it. So before I do that, I'm gonna wipe it down with an alcohol swab here. All right, make sure it's nice and clean. let it dry, and from here I would flush it, make sure it's still patent. So I'm gonna start slowly, and as I'm flushing it, I'm looking for any signs of infiltration. Looks like it's going straight through. Perfect. Now I'm gonna administer my medication. So this medication is hydromorphone. It should be given over 3 to 5 minutes, very slowly. All right, now that I've given my medication, I'm gonna flush the IV side again, just to make sure that all the medication goes through and there's nothing in the line. All right, push, push, push. Perfect. Now I'm gonna lock it again. Alright, now that I've administered my medication, I'm going to lower my patient's bed for his safety. Okay, so lowering the bed. It's at its lowest position. I'm going to make sure that it's locked. Brake is on, and here's your call line. I'm going to check on you on the peak time of the medication, okay? So I'll be back in 15 to 30 minutes. Alright. Alright, now I'm going to take my PPE before I exit my patient's room. So, alright, here we go. Without touching the inside. Took this out. Okay, just with the inside. Tuck these out. Perfect. There we go. Without touching the outside. Just keep rolling it up. Alright, so now that I've given the medication, I'm going to wash my hands and document that I gave 2 milligrams of morphine diluted over 5 milliliters of normal saline, pushed the medication over 3 to 5 minutes as prescribed, and I went back and checked it, make sure there wasn't any complications. Before I gave the medication, I also assessed the IV side to make sure that there wasn't any infiltration or signs of infection or anything like that. The patient tolerated the procedure well.